Hello everyone, my name is Dr. Joel Rosen and I want to welcome you to my brand new website, Adrenal Fatigue Society. I've created this website for people that are suffering with energy depletions, whether it's having very little energy when you first wake up in the morning, having a little bit of energy but then crashing throughout the day, maybe having no energy in the day but having energy at night so then you're not sleeping or you're waking several times throughout the evening, having musculoskeletal pain, having brain fog, not being focused, and just being overloaded with stressors. I've created this website because you are not alone. This is a real epidemic that is occurring in our society because we are more toxic than we've ever been. Our soil, our produce, our foods, our air, our water, everything that we do is overloaded with stressors that build up on the body. What I wanted to do though is I want to let you know that you are not alone, number one, and number two, you are not crazy. There is something going wrong with you, even though the doctors tell you that there is no such thing as adrenal fatigue. So what I wanted to do was create a little flow chart and explain to you how this is so. Doctors, traditionally trained medical doctors, look at adrenal fatigue as something called adrenal insufficiency. And they look to see if there's adequate hormone secretions. What that means is they do a stimulation ACTH test, which means they'll give you an injection of a stimulating hormone that with a normal response, you should see the cortisol levels rise. And if there is no response whatsoever, that is called adrenal insufficiency. If you don't have adrenal insufficiency, that means you do have some sort of response based on an ACTH stimulation test, then you are told that you don't have adrenal fatigue. Yet your batteries are still drained, your energy is zapping, you can't focus, and you are not living the life that you want to live. However, in this cycle, there has to be other things present in order for proper cortisol metabolism and cortisol function, which is the hormone of the adrenal glands. For instance, you have to have proper hormone activation. What that means is when the hormone is produced, it's not necessarily available for use. So even if you have adequate amounts, it doesn't mean that it's necessarily available. Adequate absorption. This is a huge problem. If we have toxic exposures, if we have heavy metals, or if we have oxidative stress, then it's very, very difficult for the lipid layer, or the phospholipid layer, for the cells to enter into that. And then we may have adequate levels of hormone levels, but they're not getting into the cell and they're not using their effect. Adequate cell activity. What that means is even though it gets into the cell, does it need to do what it does, or does it do what it needs to do? There are so many things that can go wrong, from energy to production to polymorphisms to genetic mutations to heavy metals and nutritional deficiencies that doesn't allow the mitochondria to function properly. Correct feedback loops. What about if you have an air conditioning unit in your home and it's too hot and the thermostat should kick in when it gets too hot and kick in cool air? What happens is over time, when it's going on and off all the time, it stops sensing the changes in the environment and doesn't accommodate. The same thing happens in our body, where our hypothalamus and our pituitary no longer signal the glands to function properly. That isn't measured in an ACTH stimulation test. Adequate hormone quality. What happens if we have nutritional deficiencies, heavy metal toxicities, infectious agents in our body from viruses, molds, infections, parasites, candida, mycoplasms? If you have nutritional deficiencies, then you are not going to have the right building blocks to make optimal hormone quality. That's a problem, and that is not measured in an ACTH stimulation test. And then we come back to adequate hormone secretion. So what happens is, unfortunately, traditional medicine throws the baby out with the bathwater and says, if you do have adequate hormone secretion, you can't possibly have any of these other things. So what you are suffering is with a very real adrenal breakdown. And so what I've done is I've created a society, and I've created success videos that you can request for by just opting in on my success video opt-in, and I will keep you in the loop, not just in the adrenal feedback loop, but also in the success secrets to what you can do to fully recover, which I truly believe you can, from your adrenal gland nightmare. This is for you. This is letting you know you're acknowledged, you're being heard, you're not crazy, and I look forward to helping you in the future. Thank you so much.